We respectfully acknowledge that the Windsor Regional Hospital occupies the traditional, ancestral, and contemporary lands of the Niswi, Ishkwiden, Anishinaabeg, the Three Fires Confederacy, Ojibwe, Ottawa, and Potawatomi. We acknowledge the land and the surrounding waters for sustaining us, and we are committed to protecting and restoring these lands and waters from environmental degradation. All right, good evening, everybody. Thanks for tuning in at 4 o'clock instead of our usual 5 o'clock. We are going to celebrate Patty France tonight at the Windsor Essex Multicultural Association's award gala. So again, Patty, congratulations. And also Bill Mara from Hotel Dieu Grace Hospital, congratulations to him. I'm going to call the meeting to order. Do we have any declarations of conflict of interest? Seeing none, I'm going to get an approval for a motion to approve the previous minutes. We have Paula Shantz, seconded by Dave Mallion. Questions or comments? Seeing none, all in favor? Perfect. As I usually do, I kind of highlight one of our initiatives that are going on at the hospital currently. This one's very, very special this year. Not that it's not special every year, but it's Lockout Cancer Month for the Windsor Cancer Center Foundation. The 2023 Lockout Cancer Ambassadors each have a unique story. You can go to the Windsor Cancer Foundation.org/lockout cancer website to see their stories. Each one of them, Tina Roy, Paula DeVito, Dr. Sindhu Kanjigal, Pam Brajic, Maddie, and Kathleen Turner. So in 2022, an average of 50 women came in for radiation treatment and 40 women came in for systemic chemotherapy treatment per day. In that same time frame, women accounted for over 57,000 visits to Windsor Regional Cancer Center for treatment and care. So please remember that 100% of the funds raised from our Lockout Cancer campaign will stay local. This campaign funds initiatives that reduce wait times, provides added comfort, and helps keep more patients close to home while receiving treatment. So this will be going on all month. So you can purchase a padlock, jewelry. You can just make a donation, sponsor a key, or attend one of the Lockout Cancer events. So please visit the website. You can get there through the WRH website as well. So please remember Lockout Cancer this month. All right, and then next up, we will go directly into the report of the President and CEO, David Mouche.
Thank you, Mr. Chair. And you have my report as part of the package. Couple things. First of all, I want to introduce everybody visually to Brandon Bailey. Brandon is our new Vice President of Redevelopment, and he just physically moved into Windsor, Essex this past month, and he has hit the ground running with respect to the planning, and we'll be revisiting. I'll be attending every single board meeting, but also we'll have more to say at the June meeting of the board regarding the next steps that are ahead of us with respect to the planning for the new acute care hospital, as well as the OLET campus redevelopment process. So everyone, welcome Brandon. The next thing in my report, I highlighted, and it's interesting because I have to do this report a week ago. So in the last week, we actually changed the name of the program, but we announced it today with the Windsor Police Services. Rather exciting, interesting program that ourselves and the Windsor Police have gotten together to try to be very proactive with respect to addressing individuals who have addictions and or mental health issues in the community. Right now, a lot of times we are, if you want to use the words, the only game in town for these individuals to go, be it the emergency department, And sometimes it's too late with respect to coming to the emerge, meaning if we had intervened earlier, they wouldn't need emergency services if we had the opportunity to. It is very difficult for some of these individuals to come to a physical location. And as a result, in working with Windsor Police, we are going to go to them and try to avoid having an ED attendance. So what we're going to start is a pilot project for the next 3 months and go to the individuals at the time of day and days of the week that are the greatest need, where we see the greatest demand, working with ourselves and Windsor Police with our data. And that's where we see it being Friday, Saturday, and Sunday nights. So we're going to have shifts that start at 11 a.m. but go all the way to 11 midnight, where a nurse from Windsor Regional Hospital is going to be teamed up with a member of the Windsor Police Services, and they will decide on a given night whether to go by foot, go by vehicle, and try to interact with individuals where they're at and try to address some of their medical needs that might be minor today, but most likely, if it's not addressed today, would result in an emergency room visit in 2 or 3 days. And we asked our nurses, once we agreed with Windsor Police on the general details of the plan, which of our nurses would be interested. And pretty much in the first hour we asked for interest, we had close to 20 nurses respond that they're very interested. So for the first 3 months, we're going to have approximately 10 nurses that are going to be available to go out on Friday, Saturday, and Sunday afternoons and evenings with Windsor Police in order to address this. 2 of our managers, Rio and Kaljit, who are managers of the ED as well as mental health, are actually going to go out tomorrow with Windsor Police. And the goal is they're going to get some learnings even from one day. And then next week, we have some more in-servicing and some training of the staff with Windsor Police, and then start in earnest the weekend of May 12th with the 3 nights. So again, the goal is to be proactive. This is, something we traditionally don't do. Is we're an acute care facility. But when the police asked individuals who might be interested, we were available to do it and wanted to help, and are going to start. The goal, again, is hopefully, and there is an examination being done through Ontario Health of all of our services with respect to whether it is what was outlined when they first started, let alone whether it meets the current demands. One of the things we talked about today is mental health and addictions has changed dramatically over the last decade. It's not what it was like 10 years ago, nowhere near. And the number one demand, number two, the hours of those demands are not what they were. And as a result, all of us have to work together to accommodate those changes and to be available. Again, right now, Windsor Regional Hospital, Windsor Police are the 2 agencies that are 365, 24/7. And we see it with Windsor Police having to go to a scene and then also, or go to an area and bring a particular individual into the ED because it's the only place they can bring them. So we're looking forward to this, and we'll keep the board up to date. And our goal is what's going to be happening is we'll be sharing data, of course, back with our own teams, but also back with the community partners on a regular basis to identify what we're identifying as the need. And if these programs did exist during particular hours, that we could accommodate that need as compared to having to bring individuals to the emergency department. This program is on the heels of something else that Windsor Police and Windsor Regional Hospital started in January. We've always had an issue where, and we're not alone with respect to this, when Windsor Police bring, so separate apart from this, Windsor Police bringing an individual to the emergency department, we have to have a safe handoff. And there would be multiple occasions where there would be multiple police officers in the emergency department, and we're trying to accommodate that handoff. They were staying in the emergency department, police, with the particular patient for, on average, 4 hours, upwards to 11 hours, until the situation could be safe enough to accommodate that handoff. That tied up a lot of police resources, being physically in our emergency department for, most of their shift, if not in some cases, all of their shift. And that resulted in less resources on the road. So this past January, we started a process in the emergency department. We have just one dedicated officer in the emerge who is there to accommodate that safe handoff, which allows then the other police officers to go back to the road or back out to the community. This police officer is able to safely take care of patients, and there's assessments that are done to determine how many he or she can accommodate. And ever since we put this into place, the most recent numbers as announced today, from going from an average of 4 hours, we're below 30 minutes now. We're at like 26 minutes being the handoff, which is exceptional. And again, allows all those police resources to go back out into the community, and for the patients to be safe in our facility and facilitate a very safe handoff with our staff. So I have to definitely congratulate our frontline staff and Windsor Police in working in partnership on that. Then also with respect to this program. And again, we're not doing this alone. Our partners at Ontario Nurses Association are clearly involved. When we approach them about this program that we're starting pretty much tomorrow, and talked to them about it and got their feedback, is they were excited just as much as we were, and saw the benefit of it, of being able to go out into the community, because either these individuals are not being addressed because they're not coming to the ED, or they are coming to the ED, but they're coming too late. So how can we deal with their medical needs in the community in order to avoid this? So they're very excited as well, and are going to be an active participant in the upcoming orientation and more training, because some of them on the Ontario Nurse Association team actually have lived experience with some of this work or equivalent to it. So we're looking forward to their insight and their expertise, because again, it's all hands on deck. And that's what we tried to emphasize today, is this is not something that anyone's going to solve by themselves. There's no way. If someone says, we're going to be the group that solves this, not happening. It's going to take everybody to work together to solve this, and to help solve this, let alone come up with a solution. It's not easy. It's all hands on deck. And hopefully the goal is too, that when we deal with this proactively, then the emergency department itself will benefit from it, with individuals who need emergent services themselves will have better access to that. So we're looking forward to it. Again, we'll keep everybody up to date. The funding for this this program that we started today is through a grant the police received from their government agency, Soljan. And again, it's a very positive partnership. And some of our community partners, we had a meeting this morning on this, and we've had meetings over the last month or so on this, raised their hand and said, we're here to help into the evening. Places like House of Sofferseen, as well as the city of Windsor. So we're looking forward to expanding that as we go along. So pretty exciting with respect to that. The other thing I want to highlight in my report, there's some other issues in there, but it pretty much is self-reading, is we did submit formally stage 1.3 to the Ministry of Health and Government this past week. And so pretty excited about that. Now we have to work with the Ministry of Health on that submission, as well as change our focus a bit, even though it's always been in focus, to the OLEC campus. and complete the 1.3 for that particular campus and the services that will stay there and or move there as we move towards the new acute. Again, we really can't do anything physically with the Olette campus until the new acute is built and until the inpatient beds are moved over from Olette to the new acute. So there is time if we're not going to be in the new acute until 2030, 2031, but we're going to get that work done now and be ready for it as we work towards shovel in the ground by 2026. So pretty excited with respect to all of that. So, Mr. Chair, based upon the time, I think I've taken more than I should already. That's my report, subject to questions.
All right, thanks, David. Questions or comments for David? Seeing none, I'll just make a quick comment then. Congratulations and thanks to the whole staff, everybody that volunteered. I know we had more than enough people to sign up for that ride along program. So thank you to the staff and thanks for to Windsor Police Services for reaching out to us. I'm glad we could help. So thanks, David. Next on the docket, we have our C&E report with Karen Rydell. Karen?
Thank you, Mr. Chair, but I have nothing to add to David's report on our nurse-police partnership. So thank you.
Fabulous. This is moving along. The Schulich report is there for your information. There is no financial presentation in May. This is consistent with prior years as we work through our year-end financial statements. The year-end was March 31st. So we will be bringing that to the board in our June meeting. Next up, we have our consent agenda, the Finance Audit Resource Committee. Can we get a motion to accept that report? We have Genevieve, seconded by Penny. Questions or comments? Seeing none, all in favor? Wonderful, thank you. Again, we have the correspondence and printed materials there. Media report, that's tab D for your information. Are there any additional questions from the board, comments, notices of motions? Seeing none, wonderful. So the date of our next regularly scheduled meeting will be, oh shoot, the date's not on there. I can't believe I did that. It's going to actually be, and Dawn, correct me if I'm wrong, we are going to collapse the normal board meeting from the first week or first Thursday of June, and we're going to put it with our our AGM. So we're going to have it on the same night. Again, there's a lot of volunteers, a lot of people involved, so we're going to put those both on the same night, and that will be June
22nd.
June 22nd at 5 p.m. All right. Again, June 22nd, AGM and June board meeting the same night for all those folks at home that want to follow along. Can I get a motion to adjourn? We have Dr. Freeman and then Patty France. All in favor? Wonderful. Thank you, everybody. We're just going to go directly, we're going to log out of this and then go directly into the